COVID-19 matters, and Parliament's Health Portfolio Committee is not happy after a briefing by the Auditor General. According to the Auditor General, Tsakani Maluleke, there were many irregularities in government departments' procurement of COVID-19 related equipment and services. Let's unpack just one or two of the biggest issues and what we're going to do about it. The Health Portfolio Committee chairperson himself, Dr. Sibongiseni Dlomo, joins us. Chairperson, good morning to you. I mean, there are so many issues to unpack out the back of this AG report, but I think one of those, if we may start here, that PPE stored in bulk storage, chairperson, and it's been left in poor condition. Good morning. What was your reaction to this kind of news?
Good morning, and thanks to your viewers. It's true that we were alarmed by the state of the report as presented by the AG. That is why we collectively, as a portfolio committee, agreed that we will need to listen to this report again with the minister present and all the 9 provincial MECs, because we can't even begin to comment. We need to be educated by them how that situation could be at that level. Look, we have been aware that there were challenges and irregularities with the PPE procurement in particular, but this was the first time that the AG brought it as a report that we cannot ignore. So we think before we can make any pronouncements, we need just to get them to take us through this as a report, because what we envisage is the report will be tabled again in the presence of the minister and the MECs. Then we'll excuse the Auditor General and deal with the report. Of course, it's a post-mortem looking at the things that have happened, but things like those should never happen ever again. So we should then be working with them to make sure that, look, that past cannot be a benchmark of how governance, of how financial management of any goods and services should take place in the Department of Health.
Dr. Dlomo, let's talk apart from the finances, but I think you're absolutely correct that obviously the mismanagement of finances is always going to be a big issue, isn't it? But let's just talk on the ground problems for a moment, and I find this very difficult to understand. Many of the PPE, much of the PPE was compromised by exposure to water leakages and severe weather conditions, including sun and rain. And the reason I say this is particularly concerning is that while some areas do have PPE, it's now seemingly being destroyed by not being protected properly, and yet we're seeing health facilities that don't have any PPE at all. I think that's perhaps the most concerning. I'm sure you'd agree.
There were days and weeks when we're hearing trade unions, the workers themselves saying, but how do we work without PPEs? And yet, some PPEs were ordered on time, arrived on time, but poorly stored, and therefore have almost what we call a shortage. That is one part we don't understand. That is one part that we are saying we can't even be able to, particular hospitals, clinics, to keep the PPEs in the way it was kept, and yet there was such a huge demand, and workers were actually complaining about the shortage of PPEs.
Doctor, what is your timeline on this? I mean, I know you've heard now from the Auditor General, we've got the report on this, you're saying it's going to be unpacked and there's going to be a post-mortem, I think is the word that you used, Chairperson, but what's the timeline on this? I mean, PPE is busy being destroyed on a daily basis.
Yeah, we were aware that because this is a really big meeting that we'd like to get all the diaries of all MECs, the minister, and the minister is actually busy this week. We also note that he's presenting his budget on Thursday, so we do not want to interfere with this week. But we said within 14 days we should have this meeting, so probably not this coming week, so that we allow the minister to make his preparations for the budget vote. But definitely before the end of next week, we will have had this meeting, and we'll probably give you an indication when this meeting will take place. I just wrote to him after we made a meeting. We've just completed a meeting with the AG and also with the department yesterday. Therefore, we then wrote and said we will have to, because we needed to inform them formally that this is what the AG shared with us. We are therefore saying, Minister, we will want you to get all your MECs into one meeting and let's deal with this report.
I'd like to just hear from you, just before I let you go this morning, Dr. Dlomo. The ANC, NEC are going to be convening this weekend to deal with the step-aside resolution. I'd just like your comments and thoughts on how you see this playing out, just as someone who's been involved in the ANC for so many years. How do you see this step-aside resolution being handled? Final question to you.
We are confident. The ANC has gone through too many other challenges in the past. This was formed in 1912. It has survived so many 109 years because of its resilience to challenges. So we are confident as members of the ANC that it will find a way forward on all the challenges that we face. I mean, the oldest organization, of course, it will have the most difficult challenges within itself, but it will always find a way to navigate through challenges and lead, because it is also not just for us happy as members of the ANC, but it is also a lead of the society. People out there say, but if the ANC is unstable, we are not happy, but we are actually confident that we will find a solution to all the challenges that the ANC is facing.
Do you think that those implicated should step aside? It really is my last question this time.
Look, I'm a member of the ANC, but not a spokesperson of the ANC. We will have our leaders convening and giving us a line of march. Why don't we leave it at that, Garrett? Because we don't really want to have too many spokespersons. ANC has given and designated certain members within our party to be our spokespersons on all issues, policies, and also statements.
Dr. Dlomo, you and I have spoken for many years. I think you knew I was going to ask you about step aside. But as always, I appreciate your time and, of course, the big issue you and I were discussing, the AG report on the misappropriation and procurement of COVID-19 related goods and services. My thanks to you, Health Portfolio Committee Chairperson, Dr. Simogaseni Dlomo, joining us here on eNCA.